This World Health Day, the World Health Organization is focusing its global attention on urgent actions needed to keep humans and the planet healthy, as well as to foster a movement to create societies focused on well-being. The WHO estimates that 13 million deaths around the world each year are due to avoidable environmental causes. These includes the climate crisis, which is the single biggest threat facing humanity. And for more on this, we joined via Zoom by the World Health Organization's Regional Director for Africa, Dr. Matshidiso Moeti. Dr. Moeti, a very good morning to you. Thank you so much for joining us. Welcome to the agenda.
Good morning to your viewers. Thank you for having invited me.
It's an absolute pleasure having you join us this morning, Dr. Moeti. First of all, what's the importance of World Health Day?
Yeah, World Health Day is an occasion, a day every year when we pause to think about health and to discuss a particular theme or problem on health as a way to trigger even stronger action on it worldwide. So we have many activities coordinated by WHO, but with ministries of health, with communities around the world, where we really focus on this day on discussing a particular theme. And then we make sure that it's not a one-day event. We discuss ideas, programs, and we make sure that we support the follow-up action in strengthening action to address whatever is the theme, the problem.
Yeah. And the WHO estimates that about 13 million deaths around the world each year are due to what? Avoidable environmental causes. So what are these avoidable causes?
Yes. I mean, first of all, the theme this year is just to help us understand that to be healthy as humans, we have to live on a planet that's also healthy. It's our responsibility to contribute to the health of our planet that will contribute to our own health. So what are some of the climate-related causes of ill health? So we've seen increasingly extreme weather events, for example, floods. And when there are floods, it means water systems are overwhelmed. There is pollution of the water, so potable, safe drinking water is not available to people. And then also when there's water lying around everywhere, there's an increase in vector-borne diseases. So there are mosquitoes breeding and other vectors that transmit diseases. And that then exacerbates the situation as far as people's health is concerned. We're also on the other side seeing global warming and seeing that this produces other health problems, extreme events, and also triggers people to move. As we are seeing desertification due to global warming, people are moving and therefore living under conditions where they don't have access to health services, they don't have access to safe water, it's a struggle to have access to food, malnutrition is increasing, and so on. So it's really a combination of climate-related factors, many of which are driven by what we do as human beings to our world. So a lot of this is in the hands of human beings.
Yeah, sure. And this theme, Our Planet, Our Health, should be a powerful reminder to us that the resolution of so many of these issues, of course, are beyond the exclusive purview of the health sector. And you've seen, contaminated water, inadequate sanitation, as we've mentioned, including solid waste management and negative impacts of climate change being the most pressing environmental public health threat. So is it then correct, Dr. Moeti, to assume that these threats to public health are compounded by weak governance practices and potential inequities in health, as well as by limited expertise and resources in the health sector?
Yes, very much so. And therefore they demand what we call an all of government response. So many sectors need to be involved in addressing some of the risks from climate change, which are at risk to health. For example, pollution, air pollution from traffic or indoor air pollution, because people don't have access to ways of energy for cooking their food rather than wood and coal and so on. These are some of the drivers of ill health. So it really requires action at the governmental level, well beyond the health sector, the kind of policies that will be made to make sure that we control pollution from vehicles, for example, and then the programs to make sure that people are informed about their action, the different sectors are supported to take their own action. And then the health sector's role is really to advocate make sure that the different sectors play their role, make sure that the policies are put in place, and ensure that there is intervention at the population level to prevent people being affected by climate change related ill health, and then provide treatment for people. So it needs policy, it needs political action, political determination, it needs a partnership with the private sector as well, because some of the drivers of this are very much in the private sector. It really does need strong government action combined with partnership with the population so that they play their role, and the private sector in many cases also plays a strong contributing role and could be a key partner in prevention.
Sure, and in addition, I suppose, to policy and strong government action, I suppose the focus should be on the priorities to ensure that the continent is better prepared next time it is faced with a health crisis like COVID-19. Dr. Moeti, lovely chatting to you. Thank you so much for joining us.
Thank you.
Thank you. That was Dr. Matshidiso Moeti. She is the head of, the W.H.O, the World Health Organization Regional Director for Africa, Dr. Matshidiso Moeti.